The Group 6 Health and Education 2016-2017 Master of Science in Public Health students presents an 11-week community health and education intervention project in Itamarun community. The group members are Ezekobe Ifechi, Majekodumi Olufunke Oluwaseun, Kukoye Folayemi, Arabi Oluwaseun, Adeboga Oluwaseun, Ogbonna Grace, Owate Oluwatomisi, Aina Abiola, Ogunmefun Oluwatoyin, Ukutie Uzo. Itamarun is a community of about 3,000 residents in Ibeju Lekki LCDA, Lagos State. It's along the Lekki Free Trade Zone. She shares her boundaries with Apakin to her south, Oriyanrin to her north, Otolu to her west, and the Atlantic Ocean to her east. Their occupation to date includes fishing, farming, and trading. Basic education and literacy levels are less than 10%, and there is a screaming poverty level of more than 90%. The village has a serene beach which can be tapped for purpose of tourism. Group formal introduction meeting, brainstorming and situation analysis. It all started after the health and education class when group members were assigned to the Itamarun community. They were meant to assess the health and education needs of the community and deliver an intervention as deemed fit. The group members met and brainstormed on the objectives, budgets, resources, and strategies to employ. The team met with the Bale, Chief Ruben Obutu, unannounced in the absence of any contact person. Introduction and statement of purpose of the group was done at the Bale's house, and the group was graciously received by the Bale. The Bale then called upon the elders and youth leaders of the community to meet with the team. The community's requests included a school, an eye clinic, public toilets, and means of power supply for the existing borehole, which were capital intensive, and they pleaded that the group help to raise awareness to the concerned people to address the situation. On leaving the Bale's palace, group members could not help but notice a lot of flies and strong stench of excreta as a result of open defecation. The borehole was not functional as there was no source of power supply, and they also noticed a clean environment devoid of litters and dirt. Health education was given on dental care and the right way to brush the teeth, with demonstration being made and the active participation of the community members present. There was distribution of toothbrushes and toothpaste to both adults and children. Health education on hand washing, personal sanitation, and environmental health demonstration was made, and the participants were involved in the demonstration. There was health education on the use of long-lasting insecticide-treated nets for prevention of malaria. Demonstration was made on how to effectively use this LLIN net. There was education on all the food classes or types and healthy eating habits. Demonstration was also done for all the food groups. Health education on deworming and its importance. Distribution of deworming drugs to children and adults that had not been dewormed in the last 6 months was done. Team members rescheduled a planned malaria screening as they sympathized with the community, which they met in a mourning mood over the demise of an illustrious son and husband to one of the community leaders. Then, malaria screening exercise using a rapid diagnostic test kit was done. Participants who were positive to the RDT were given artemisinin-based combination therapy. While a reproductive health intervention health education on family planning and sexually transmitted infections was done with the adults, with distribution of barrier contraceptives, condoms.
The children had fun learning and singing rhymes. Then the skits were shared and the children received coloring picture papers for submission on the group's next visit.
Screenings for high blood pressure and diabetes mellitus were carried out, with referral letters given to those who had positive results. There was eye screening, exercise, diagnosis, and referrals also issued. A spelling bee was organized for primary school children, and back-to-school items were distributed alongside Bonvita, biros, wristbands, and candies in conjunction with Cadbury Nigerians PLC. A generating set was also presented to the community to power their existing borehole.